Welcome to Cancer Newsline, your source for news on cancer research, diagnosis, treatment, and prevention. I'm your host, Dr. Oliver Bogler. Dr. Prinsloo, you've been working on something called chronic chemotherapy-induced peripheral neuropathy. Can you start by defining what that is?
Absolutely. So after chemotherapy treatment, a large majority of patients suffer with things like pain, numbness, tingling, complete loss of sensation that can be quite debilitating to the point where they need to use walkers to walk, they're off balance sometimes, can't use their fine motor skills to pick up objects, that sort of a thing. So survivorship for them means something quite different in terms of recovery. They're still dealing with some issues left after the chemo.
Those are some serious challenges. So you've come up with a new way of trying to help those patients with something called neurofeedback. What is that?
Absolutely. Neurofeedback's been around for a long time, since the 60s actually. It's old NASA technology. But now we've gotten to where we can bring it into a more clinical world. Treating pain conditions is obviously my interest. And so we do EEG neuroimaging, and we figure out where on the brain these signals from the periphery are being processed. And for example, if people's feet are numb, we know that there's aberrant signals coming from the feet, but the brain is actually the source of the perception of that problem. And so we figure out where on the brain that's happening through a QEEG or a brain map, and then we do a treatment plan, and they play a video game for us, the participants do, such that they're rewarded every time they change their brain function. And the reward looks like a pretty picture on the screen or an auditory beep goes off. And then with repetition, they learn that, and they can do it without us.
So brain map, how should we imagine that? How do you get a brain map?
So a brain map, you do a 19 electrode EEG. We put it in a database of hundreds of other patients or people without neuropathy, and we do comparison maps basically. So we look for hot spots, and the images actually look like an MRI would look, but it's highlighted in where areas of activity are. And so we know where to target, and then we use our operant conditioning in those areas.
I should probably let our listeners know that I've participated in some of your research. I've been one of your guinea pigs.
You have.
Very grateful. And so I had to wear a hat or sort of a web on my head. It wasn't painful, and your technologist squirted some gel in there to make good conduction with my scalp. And that's how you'd made the map, right?
Absolutely, yes. That's the first step. And then once we get that data back, then we decide where on your scalp we're going to treat, monitoring your brainwave activity while you play the video games for us.
So you're training the brain of the patients. What's the ultimate result?
So the ultimate result, and what we showed in our recent publication in Cancer, is that we can change the activity under the electrodes that we've deemed the most important via the brain map. And we do that through operant conditioning. Once the brain is taught to do a more normal interpretation of the aberrant signals being sent from the hands and feet and fingers and toes, then it basically can interpret what I think is aberrant signals, and then the brain says, you know what, this is just normal for me now, so I'm not going to give you a symptom such as numbness or tingling. So it just sort of reinterprets those weird signals.
Does it work for most people?
Most people, yes. Yes.
And does it last? Once the brain is trained, does it remember this?
So in our first study, we followed patients for 4 months afterwards, and there was some regression to baseline, but it was still much better than when they came into the study. So we don't have any long-term, year follow-ups or so forth, but we're very optimistic. Again, we're limited because it's a research study. So we give, as you know, participants 20 sessions of neurofeedback. They may need a little bit more than that to make it more long-lasting, but that'll be another study. We don't know yet.
I have to say that I think I finished your study a few months ago,
Yes.
and for me it's been fantastic. It really changed. I had a lot of numbness in my feet. It's really changed the way my feet feel, and I'm very grateful to you for doing this.
So happy.
How does a patient who's interested in this, how do they access this kind of opportunity?
So they can contact me directly. My information, my email is on the website, I believe. I get a lot of referrals from MDs, so if they're seeing their oncologist for a follow-up visit or their survivorship clinic or anything like that, those folks also know how to get in contact with me. So we'll try to make it as accessible as we can.
And what's next in your research? Where are you taking this next?
I want to look at prevention, and so I'm very interested in the brain and interpreting these funny signals from the periphery. And if we can kind of track that over time as patients are undergoing chemo, for example, there's a potential to intervene for people that may have worse neuropathy than others. For example, we could jump in early, do some neurofeedback, more of a peak performance model before or during chemotherapy.
Well, thank you very much, Dr. Prinsloo. You're really making a difference in the lives of our
Thank you.
patients.
Thank you.
For more information, visit mdanderson.org. Thank you for listening to Cancer Newsline. Tune in for the next episode in our series.